Several interviewees expressed that there was a lack of care from most of the healthcare professionals that they had engaged with, although there was a recognition that it was due to the lack of resources within the NHS and that the doctors and nurses and NHS staff were stressed and overworked.
Some interviewees reported positive experiences with healthcare staff and understood the challenges that were faced within their roles, particularly nurses. However, many more mentioned experiences of being rushed and not listened to.
People in the community have been so dissatisfied with the quality of care that they've received from their GP to the point that they've considered paying for private healthcare services, which of course, as you can imagine, that's quite ridiculous. The NHS system is there for a reason. But as they're simply fed up with long waits and only to receive substandard care at the end of the treatment, it can be a bit discouraging.
I've had a GP who doesn't even really make eye contact. He'd speak, ask one question, turn away and say, "Alright, I'll give you this." Then you're out in 2 minutes.
The reason why I didn't take the medication I was prescribed is because I don't think the GP put enough effort into finding out what my issue was. It was just get in, get out.
GPs rush through things. They don't thoroughly go through things with you. I feel like they have a preconception about what it is before the patient even speaks or explains their experiences.
Some GPs, when you go to them, they don't have time. They don't have the time to sit down and listen to you because their time is short.
I think there is a quarter element that is implemented. I think it's more of a numbers game with GPs than it is about the individual.
Several interviewees expressed that there was a lack of care from most of the healthcare professionals that they had engaged with, although there was a recognition that it was due to the lack of resources within the NHS and that the doctors and nurses and NHS staff were stressed and overworked.
Interviewees reflected that the lack of funding healthcare staff face alongside being extremely busy could contribute to the level of care that they can provide.
In our focus group around Rethinking the NHS, participants came up with a number of ideas and recommendations around how they think the NHS could make adjustments to be more accessible and inclusive.
The group also had ideas about how to make the NHS more approachable and improve the relationship the NHS has with ethnic minority groups. This included increasing work experience opportunities in the NHS for young people, providing more community outreach, and allowing for a more holistic approach to treatment if people would like it.